The career prospects is, one can be a leader in the hospital operations. Operations is the nerve center of the hospital. The point the patient comes, the front office, the billing desk, the the allotment of accommodation, the management of beds, the management of the rooms, their decor, and so on and so forth, and providing the right kind of food and diet and experience. All that comes as a part of the hospital operations. So generally, operations head is also many a times is the PRO of the hospital also in many cases because he is handling maximum patients. So this is one place as manager operations or executive operations one can drop in. It is a very good again line to remain in operations. The second is you can become champions in the support function in a hospital. It could be the support function could be the in charge of the sterile supply system, or in charge of the linen, or in charge of the materials. So there are many other support functions which are available, particularly purchase, particularly management of material, management of the bio waste, management of the laboratories. So those are some of the areas: executive lab, radiology executive, lab executive. You don't need to be a laboratory technician. Again, there is a managerial requirement of organizing the service around. So that is a support function hospital champion. Quality head is coming in a big way. Most of the hospitals are now going in for accreditation, and insurance is continuously pressurizing that accredited hospital will get more money, and only accredited hospital will get into the insurance health finance mechanism. So, lots of hospital administrators are coming into the quality domain, and they are the watchmen of the systems, processes, what we deliver. Because quality is all about do what you say and say what you do. So, therefore, once you have developed a quality manual and a process, you start measuring how much you are achieving. And that is the job of the quality to train, to lead, to design process, to, to ensure that there is measurement tools available and discuss in the quality steering committee. And there is a continuous engagement for continuous quality improvement. So this is something which is very, very relevant for all hospitals which are 150 beds and above, at least. Marketing and sales, again, a wonderful area where you can design creatives, you can go to community, you can understand the healthcare products. If you are wanting to sell cardiology services, you should understand what are the different processes involved, what is the disease demography in your area, how people are suffering, what is the market segment you have to capture, and then you develop a relationship and community connect through various activities, outreach programs, camps, health talks, free camps, bringing them into system in some form, and then doing the sales part of it. So therefore, marketing of hospital products are not very novel products, and it is very, very concept based area where one has to be conceptually very strong, because these are products which have to be sold in a subtle way. You cannot create hoardings, you cannot say buy one get one free, and yet you have to ensure that you have a good community connect. So therefore, marketing and sales is a very, very important part of the hospital, and people from marketing sales background have become CEOs some of the top hospital chains in the country. Then IT, it is the backbone of the hospital function now. All hospitals have got hospital information system. All hospitals which are in the insurance segment, working in the insurance segment, by mandate they have to have a automated billing system. So therefore, from there it has evolved into a paperless hospital, telemedicine, telemonitoring, remote ICU mechanisms. All that comes in the domain of IT enablers. And I think I will be 50% of my efficiency without the IT head support in my hospital. So it is a very good department. Again, health informatics, health IT, and a lot of innovation one can do. The field is immense. Each hospital has got its own system, and it can really decide and to go ahead and evolve small applications, small apps for various small functions, create groups, create email targets, and so on and so forth. So there is a lot of innovation applicable in the hospital IT environment, in addition to the standard off the shelf product which they implement. Finance management, again, from accounting, costing, billing, service pricing, it is very important function. It is the output area. And again, generally hospital based finance managers were not available till around 15, 20 years back. And we had to rely on either young chartered accountants or people who have worked in so allied companies to come. And they had no knowledge of the products, and it used to be invariably a price conflict where they would cost it differently, we would cost it differently at doctors. But that line is now gradually diminishing. There are a lot of people who have worked in hospitals, learned, and now moving in the hospital field itself and growing further. Second is a good mix of people with finance background who have handled diverse product and who have handled hospital product. If the department has both, it makes a very good mix because they can be both bring their individual perspective. And again, then there was a time when in the India, most of the large hospitals, whether it is Fortis or Max or NH, or even in some cases Apollo, the finance guy was leading the operations also. They learned over a period of time, and they all became from CFOs to they stepped into CEO's role. So again, there is a immense growth potential in the finance side as well. And of course, human resource management, right from beginning of my discourse today, I have been saying that it is a people-based industry. You have to manage people, talent retention, skill building, talent acquisition, keeping the employees engaged, stress busting mechanisms, keeping the right kind of payrolling mechanism, making sure that your doctors are happy in your environment, building an environment of trust around your key earners, that is your doctors and nurses. All that comes in the domain of human resource managers. And I think, again, a fantastic area to work in a hospital sector. And this is one place where the best practices from any other industry is welcome because this is quite raw in the hospital industry now. And I found that people from hotel background have come with very good perspective. People from hardcore product industry or FMCG products, they have come. They also brought in very good energy into the sales, channel marketing, and other things. So therefore, I would recommend that human resource managers, they need not be prototyped or stereotyped from the hospital base. They should gather best practices from various industries. If you are young, do an intern in some other industry and then come to a hospital, you will be able to really add value. So that is what I think. Again, a good fresh MBA HR would be hospital is again a very good destination, very good destination. So what are the destinations where people work? I would say first is the mid-size to large-size hospitals. Now there are chains of clinics are also coming up. Narayan has got, NH has got clinics, Apollo has got clinics, Max is also looking at clinics. So the clinics are the daycare centers where few basic procedures can be performed, consultation can be given, and diagnosis can be done. The unit head of the clinic, chief administrator of the clinic, as independently running the show in the clinic is one role one can look at as a beginning. Nursing homes, again, large size nursing homes, they do observe. Mid size nursing homes, they also do observe as a head of operations. That is where you can see. Consulting firms, again, a lot is happening in the healthcare delivery mechanism. So various modes of public delivery, public health goods, including and also project development, private sector, hospital productivity enhancement studies, IT-based studies, IT enabling studies, automation platforms, cost containment mandates. I have done few of them in my consulting days. The product and volumes in the consulting side with a knowledge of hospital administration is immense again. Health insurance organizations, they also look at administrators to look at the delivery of their products and services. Then associations and foundations, Bill and Melinda Gates Foundation, Public Health Foundation of India, Red Cross, and so many others, UNICEF, they also need healthcare delivery experts who can associate with them for larger public cause. Public health departments, of course, the NRHM has been one of the largest absorber of budding hospital administrators from the business schools like IIHMR. They have hired in bulk because they mostly look at district program manager, divisional program managers, quality managers, and in the hospitals they are being posted as administrators because many a time the hospital CEO in a district hospital is a busy surgeon who has to double the role as the administrator. So he relies upon the person who is trained and qualified. There has been a mandate by the last national bodies and I think the Planning Commission document where they said that all district hospitals must have a qualified administrator, and that is being gradually rolled out, and many states have absorbed it in many different shapes. So that is again one area where one can look at. At present, most of the states have taken them on contract because the regular posts have still not evolved in the public service commissions. But I'm sure in days to come that myth is also going to go, and people will advertise for full-time, full-role capacities. Rehab centers, again, that is coming up in a big way. Very unfortunate. Country is going through a turmoil. We have got a lot of de-addiction centers, rehabilitation centers. That is again a big industry coming up. And again, there is a requirement of qualified administrators. Universities and research institutes. Of course, there are, like All India Institute has got two WHO seats for collaboration in the field of hospital administration research. There are many other agencies who are doing different pieces of work, how to improve hospital, how to improve, particularly more related to cost efficient public health delivery mechanisms. So these are some of the areas where a bundle of research is taking place. As a research associate or a scholar and as a PhD associate, you can do that. So these are some of the areas where a qualified administrator, once you have done the course, you have immense potential. The canvas is actually open, and the number of I have just scratched the surface to tell you a glimpse of it. Actually, the opportunities are multifold.